This is the partial bed bath skill. The supplies that I'm bringing into the room are a barrier, a pair of gloves, a bath blanket, a towel, 2 washcloths, and a clean gown. Let's begin. Hi Kendra, my name is Cindy. I'm here to give you a bed bath. Is now a good time? She says that it is, so I'm going to put my supplies down, starting with my barrier. And I'm going to make room on my barrier for my basin. Next, I'm going to sanitize my hands, rubbing until dry, and I'm going to close this curtain for privacy. Next, I'm going to make sure the brakes are locked. I'm not going to be in a hurry to get my basin of water. I don't want it to get cold, so I'm going to do a few things first, including starting with my gloves. And I'm going to provide for the comfort of my resident. I'm going to put a bath blanket on her. And I'm going to fold this up over, they're unfolded, and I'm going to ask her to hold on to it while I remove and pull down this flat sheet. It's not a bed making skill, so I'm not actually going to remove it. I'm just going to put it down to the foot of the bed, and I'll pull it back up later. All right, now I'm going to provide support for her head and untie that gown. I do have to remove that before she has her bath. I'm going to be careful not to expose my resident when I remove her gown. I'm not supposed to reach across my resident, so I'm going to walk around to remove her gown from the other side. There we go. Let's roll up this used gown, put that in the hamper. Now I'm ready for my water. I'm going to get my basin, put my lotion and my soap on the barrier, and then I'm going to go to her bathroom to get her water. Using a barrier, I'm going to turn on my water. Check it for temperature. That feels about right. Whenever I'm working with water, I bring it back to my resident and I ask her, Kendra, can you check this water temperature for me? She says, that feels just right. I'm going to put my basin on my barrier, and then I'm going to start moving things around in my environment so that I don't have to walk so far away. I'm not going to be leaving my resident's side for a while, so I'm going to raise up the bed to about my hip or waist height. The first thing I'm going to do is completely unfold her towel, and I'm going to provide support to her head and neck. I'm going to lift her up and put her towel on top of her pillow. We're going to keep her pillow dry while we do her bath. I'm going to put my washcloth into this nice warm clean water, wring it out completely, and fold it up into my washcloth onion. We do have a washcloth onion video if you'd like to watch that. We clean from cleanest to dirtiest, top to bottom, inside to outside. So I'm going to start with the eye furthest away. My first wipe is straight across the eye furthest away. Change surface, eye closest to me, change surface. Make like a number 3, forehead, cheek, chin, furthest away, change surface, forehead, cheek, chin, closest to me, change surface. Put this washcloth on the side of the bin, and I'm going to pat dry in the same order. We never rub dry. Pat, 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 pat. We do the same on the other side. I need to wash behind her ear and down her neck. I'm going to put that same washcloth back in the water, warm it up, wring it out. I'm going to unfold it, and I'm going to put soap on all sides, on both sides. Notice that I did this after I wrung the water out. Flip it over. I'm going to put soap on the second side. Again, I'm going to fold it up into my washcloth onion. So I have 10 new clean surfaces, and we start back over at our first clean surface. So furthest away side first, around the ear and down the neck. Kind of looks like a question mark. Change surface, around the ear and down the neck. change surface. This has soap on it, so I can't pat her dry yet. What I wash with soap, I have to rinse. So I'm going to rinse this, wring it out, fold it into the washcloth onion, and I'm going to rinse. Side furthest away first, around the ear, down the neck, looks like a question mark, change surface, around the ear, down the neck, change surface. I'm going to secure this on the side of the basin. What I wash, I rinse. What I rinse, I pat dry. Around the ear, down the neck, around the ear and down the neck. Her head and her face are clean. No soap on the face, only behind the ear and down the neck. I'm going to remove this pillow or this drip towel from the pillow because now I'm going to wash her chest, and I'm fan folding this over her arm to keep her warm while I pull the bath blanket down to about her belly button area. I'm going to pick up my washcloth and side furthest away first, up, around, and down to the belly button, change surface, up, around, and down, change surface. What I wash, I rinse, up, around, and down, change surface, up, around, and down, change surface. What I wash, I rinse. What I rinse, I pat dry, reach that across and pat. I obviously always look at the skin for areas that are discolored or reddened. Her chest is washed. Let's put the bath blanket back. And now I need to wash her arm using 3 wipes. I'm going to provide support for her arm. And I'm going to put this towel down. I have to keep her sheets dry. And when I wash her arm, I'm going to provide support, and I'm going to do this wash in only 3 wipes. Start at her shoulder, down the back of the arm, the outside of the arm, the fingers, put her hand down and change surfaces. That was my 5th clean surface, so I'm going to very carefully unfold the washcloth and refold it in the opposite direction. So now I have 5 additional clean soapy surfaces. I'm going to pick up her arm. My second wipe on the arm is from the inner elbow, down the front of the arm to the palm of the hand to the fingertips. Change surfaces. My third and final wipe on this arm is from the inner elbow up to the underarm area. Give it a good wash. Change surfaces. What I wash, I rinse. 3 rinses. I'm going to start with the shoulder. Start of the shoulder, down the back of the arm, the back of the hand, right down to the fingertips. Put her hands down. That was my 5th clean surfaces, my 5th clean surface. So now I'm going to fold it inside out, exposing 5 additional clean surfaces. So I'm going to do my second rinse, which is from the inner elbow down the front of the arm to the palm of the hand and the fingertips. Put her hand down, change surfaces. My third and final rinse, start at the inner elbow and go up to that underarm area. Give a good rinse. Change surfaces. What I wash, I rinse. What I rinse, I pat dry. It's important to pat the entire arm dry, especially in that underarm area. It has to be nice and dry. The front of her body is all clean. So I'm going to help her roll onto her side. She doesn't cross her ankles very well, but if she could, I would do that for her on the count of 3. 1, 2, 3. Now for privacy and dignity, I do need to try to keep my resident covered up as well as I can. I'm going to wash her back now, so I'm going to reposition this towel along her back. I'm going to pick up her washcloth and I'm going to wash up, around, and down. I do the upper part of her back first, change surfaces, up, around, and down, then the lower part of her back, change surface. What I wash, I rinse. Start at the bottom, up, around, and down, change surface, up, around, and down, change surface. What I wash, I rinse. What I rinse, I pat dry, always looking at the skin for any areas that are discolored or broken. I'm going to give her a back rub. Do you want Neutrogena or unscented? She says, I'll take the Neutrogena. I always rub this to warm it up. And I'm going to verbalize that I would give a back rub for maybe 5 minutes, 3 to 5 minutes. But for our checkoff, that's just fine. Whenever I put lotion on my resident, I always pat dry. So her wash is done. We're going to roll over on the count of 3. 1, 2, 3. And I'm trying to keep her as covered as possible. I need to put a bath blanket on. No, I need to put a clean gown on her, and I'm going to put it over the top of this bath blanket. I don't want to expose her, and I don't want her to get cold. Wrong way. Okay, I have to put my hand through the sleeve of this bath blanket, grasp her hand like a handshake, and guide the gown over the top, protecting her fingers. I can't reach across my resident, so I'm going to walk over to the other side. While I do that, I'm going to put my towel in the hamper, and I'm never going to let go of my resident. On this side, again, I'm going to put my hand through the sleeve of the gown, and I'm going to do like a handshake, protect her fingers, guide that gown right over the top. Then I'm going to help her to raise her head, provide support. And I got the string, the tie for her gown, and I'm tying it off to the side because I don't want there to be any kind of a bump behind the back of her neck. Straighten out this gown. I do want to remove this bath blanket, but I don't want her to get cold, so I'm going to put the sheet up first. And now that that's up, I can very carefully remove the bath blanket from underneath, providing a little bit of straighten up on the sheet. While we go, it's not a bed making skill. Hold on to my resident. It's not a bed making skill, but as long as I straighten it up just a little bit, that would be fine. I need to get rid of my basin, but I can't do that with my bed in the high position, so I'm just using my knuckle to lower the bed. And I'm going to take my washcloths and put them in my hamper along the way. I'm going to go to the bathroom. I'm going to dump this wash water in the toilet or the commode. Just like I washed, rinse, and dried my resident, I'm going to wash, rinse, dry my basin. Wash water goes in the toilet or commode. Rinse water goes in the toilet or commode. Shut off that water. Fresh paper towels. And I'm going to dry my basin. Coming back to the resident's bedside, I'm going to put my supplies away where I found them. My last dirty supply is this barrier. Let's fold it up neatly and put it into the hamper. My dirty supplies are gone, so I need to take off my gloves. I'm making a little bit of slack. Dirty to dirty, wadded up over the back of the wrist, clean to clean, fold it inside out. I'm going to put that in the trash. Normally, I would do a soap and water hand wash after removing my gloves, but for this skill, it's okay to use sanitizer for my second hand hygiene. What I have left is my 3 L's. My bed is still locked. It's still in the lowest position. And the third L is her call light. She says that she wants it in her right hand. And she says she doesn't want any water or anything like that. If I need to make a correction, I can, but I think I'm good. So I'm going to open the curtain, do my third hand hygiene, and say that I am done.